And the third, which we often forget, are the synthetic functions. The first one is the vitamin D activation, which is required for healthy bones. Second is energy required for blood pressure regulation. That is generation of new glucose during fasting stage. So as per International Society of Nephrology, kidney disease can be categorized into acute kidney disease, acute kidney injury, and chronic kidney disease. So this classification is mainly on the basis of duration. If the kidney failure occurs within 7 days, then it is known as acute kidney injury. If the failure persists for more than 7 days but less than 3 months, it's known as acute kidney disease. And if the failure persists for more than 3 months, it will lead to debunk some common myths related to kidney disease. A very common myth which usually patients come across in OPD, they will usually ask a question that I have my deranged renal function. So is there a problem in one kidney or two kidneys? So whenever there is an elevation of serum creatinine, usually both the kidneys are involved because a single healthy kidney is sufficient enough to sustain a normal life. And this aspect is very important for all of us to understand because this can help us in promoting kidney donation and help our dialysis patients succumbing to death waiting for a suitable kidney. The second myth is that kidney disease is very rare and not a serious condition. But actually, kidney disease is the fastest growing chronic condition all over the world. As we can see, it is believed to affect 1 in every 10 Indians. And 5 lakh Indians are believed to be in need of treatment with dialysis. As the data shows, we can see that the number of deaths attributable to CKD have jumped to alarming numbers in last 30 years. Is that you know if you have any kidney disease, but it's not like that. All disease patients don't present with a symptom. And whenever there are symptoms, it means that the kidney disease has already advanced. So CKD actually is an insidious entity which happens over years. There are various signs and symptoms indicating that you can have kidney disease. The common ones are frothy urine, blood in urine, puffiness of eyes, and swollen extremities. But again, this swollen extremities never mean that it's always due to kidney problems. We should always try to rule out other causes. And as we can see, the other symptoms like drowsiness and tiredness, sleep problems, persistent itching, these are very non-specific. So every time we cannot rule out a kidney disease on the basis of clinical indicators. So this is the high time when we should start screening high risk categories at an early stage and prevent progression. The next myth is that there is nothing you can do about getting a kidney disease. But the fact is, most cases of kidney disease can be prevented. The most common cause of CKD in India is diabetic nephropathy, followed by hypertensive nephropathy. So, if we curtail them at an initial stage, if we take care of the risk factors, get them controlled at right time, then we can prevent the progression of kidney disease and get rid of the burden. So, some of the common risk factors of kidney disease are high blood pressure, diabetes, heart disease, obesity, smoking, and family history of chronic disease. Now, as we can see, these are the high risk categories who are at risk of getting the CKD. Now, many people think that it's very difficult to screen for kidney disease, and screening is a costly affair. But it's not like that. We need just two simple tests to screen for the kidney disease. One is a simple urine routine examination or a test for albumin or rather albumin creatinine ratio. And the second one is a simple blood test for creatinine to estimate glomerular filtration rate. So this is the CKD heat map provided by International Society of Nephrology, where the patient's primary albumin to creatinine ratio number. And as we can see the levels, these green levels mark those patients who are not at risk of CKD. Yellow patients are at increased risk. Orange colored marks higher risk patients, while the red ones mark those who have advanced CKD. And the last myth is that all kidney diseases are incurable. No, most of the kidney diseases are curable, especially the cases of nephrotic syndrome and chronic glomerulonephritis, because many immunotherapies and newer drugs like rituximab are there with us, which can help in reversing the normal renal function. And secondly, for chronic kidney disease also, we have various measures by which we can halt its progression and avoid dialysis for as far as possible. With this, I would like to share a case which presented to our OPD with a serum creatinine of 3 and massive proteinuria. His biopsy was done and we treated him as per report. And now he has come with a report of serum creat of 1 and proteinuria of nil. So this is the point where we should screen the patient and give them management as early as possible. So there are 5 golden rules which would keep in mind to keep our kidneys healthy. That is, first is keep yourself fit and eat healthy. By this, we can curtail the risk factors like diabetes and hypertension. The second is a healthy fluid intake. Around 1.5 to 2 liters of water is prescribed every day. Third is optimize your blood pressure and sugar level. You should keep it screening, and whenever we see deranged levels, we should go for management at the earliest. The fourth cause is excessive use of over-the-counter pills intake, especially analgesics and herbal medicines. So this should be taken care of. And the last one is all kinds of addiction, mainly smoking and alcohol intake. A word on World Kidney Day, as Dr. Raman already told before, that it is a campaign celebrated by International Society of Nephrology on the second Thursday of March, and its main goal is to increase the awareness and reduce the impact of kidney disease. So a unified approach is the need of hour. Both the patients as well as doctors community are required to be equally aware to curtail this burden. And take home message will be that kidney diseases are prevalent due to changing dietary patterns, unchecked use of pills, and awareness is highly essential so that high risk patients can be screened at an early stage and progression can be stopped. And we should keep in our mind the 5 golden rules to keep our kidneys healthy. So today, let's pledge to boost our kidney health and reduce the impact of global burden of kidney disease on the healthcare infrastructure. Thank you so much.